So, okay, let's do this. Or what? Um, okay, so let's do this. Joy, Bianca, hi. It's so very nice to see you both. Bianca in her morning routine, Joy in her afternoon routine. It's late in the evening for me in Europe. So three different continents in one video call. So the aim of this meetup was for us to reflect a little bit on the last 2 years, to see what we've observed in the digital health space. So maybe as a warm-up question, let's just start with, how was your situation in the last 2 years during the pandemic? Bianca in Melbourne, Joy in the US and Mexico, and I'll also share a little bit about how the whole situation unraveled here in Slovenia and in Europe. So Joy, go ahead.
Yep. So I had a really unique timing. I moved to Mexico March of 2020, like literally leap year day, not having any clue what was going to happen. So I had just kind of been set up for a big life change already, but had no idea like what was coming down the pike. And so I spent the majority, like the first part of 2020 in like profound isolation. I knew I was in a new country. I didn't speak Spanish fluently. I still don't. And I had just moved into a new home and was like, oh my God, what just happened? The borders closed and I was like trying to figure my way, right? And just really using that time to connect and through Zoom and like meet up with people as much as possible online and take advantage of all of like the digital ways that we can stay connected. And so that time alone really like was a time, it forced me to be in a time of growth. And so I learned a lot just personally and professionally at that time. And it kind of impacted me on like I'm just trying to think of like, how can I make a bigger impact and kind of create the community that I'm seeking. And so that sort of spawned a couple road trips, because that ended up being like a safe way to travel, like to meet with people outdoors, but still kind of tap into them. And so without like taking up too much time, but yeah, it was like the balance between spending a lot of time alone and then finding ways to connect.
Mm-hmm. We definitely are going to dig a little bit more deeper in that road trip of yours that you should write a book about. But Bianca, what's your situation at the moment? I know that from the global perspective, we've been looking at Australia and just trying to figure out like how can the whole vaccination situation be as bad as it was there. It seemed that you didn't have the opportunity to get vaccinated for a very long time. So what's the status now?
That's right. The status now is we have 90.4% of our population double vaccinated, and we've opened up, and we've all received letters in the mail to remind us to have our booster shots. So that's good. Until recently, proof of vaccination was required in retail shops, in all retail stores, but now those rules have recently changed. So in certain shops like hairdressers, you'll need to prove that you're vaccinated. In other shops, you just need to check in, into the store. We see job openings now, more flexible working arrangements, and I think a country ready to lead innovation in the 21st century. We're doing really well at the moment. About 10 years ago or more, when I started in this industry, I thought that Australia was quite slow off the mark there, but now I think we've really we're doing very well. Here in Melbourne, we had 6 lockdowns, which meant school closures. Working from home. My husband was working at a hospital some of the time, so it meant putting your career on hold, looking after the kids, doing home learning with them, and the elimination strategy worked quite well until it stopped working, and then we needed to rethink the strategy here. So thinking back, it feels like forever, but I went on a trip in January 2020 to Chattanooga, Tennessee by myself. Flew across the world, multiple planes, went on this adventure, to go to a conference just for a few days and then come home. But when I landed that same day, it was declared that there was a case at Melbourne Airport of COVID-19. So that's really when it all began. And I'm just so glad I got that trip in beforehand, because our borders have been closed until very recently. You still cannot fly from Melbourne to Western Australia in the same country, but we're now accepting people from international travel. So it's quite interesting. We can't see my grandmother in Perth, but we could have relatives from America come here.
Does that mean, can you drive there? Or can, like, if you needed to or wanted to, could you drive? You just can't fly?
No, you cannot, unless you have an exemption. I mean, there are some circumstances where they will let you, but it has to be really, you have to apply for that. But no, the border is absolutely closed and we can't travel there at all. So there was a lot of, I think, a feeling of isolation during this pandemic here in Melbourne, where, so under the lockdown rule, when we were under lockdown, you could not travel past 5 kilometres from your home. We could not walk 5 kilometres from our home. We could not drive 5 kilometres from our, or anything. My parents live 25 kilometres away, so we couldn't see each other during those periods. But my mum, who has a mother in Perth, that's a lot further distance, and they still cannot actually see each other. So we're just hoping that things change. Apparently the border will open in about February of 2022. But, you never know. So we're just, trying to keep positive and just some perspective as well, to remind ourselves that, we're all going through something quite profound here, and we're all making sacrifices as well.
So is it still the 5 kilometers? What is it now?
No, now you can travel as far as you like in Victoria, but it was until quite recently, and it slowly happened as vaccination rates went up. We were then given, more rights in terms of what we could do. But that feeling of 5 kilometers, I have to say, it felt really restrictive, and I felt a bit stuck. I'm stuck in this area and I can't go anywhere else. That being said, we didn't have police marching down the street. We didn't have robotic dogs walking down patrolling us. But there was a sense that that we're going to stick by the rules and do this, and it worked very well for a long time. Victorians did amazing in terms of the elimination strategy. We had 0 cases for a while, and then it just stopped working, and so we needed to do something else. But vaccination rate's really great, and it's looking good.
Yeah, you really do have an amazing situation, because like here, when the pandemic began in 2020, we were clearly very scared, as was the rest of the world. So for a while in the first wave, Slovenia was doing amazingly. We were #1 in the way the pandemic was managed, in the number of cases that we managed to keep. So the numbers were really low, and the situation normalized a lot. But then the government changed, and everything just went downhill, and it's been bad ever since. Like there were protests that started against the government 87 weeks ago. So for 87 Fridays in a row, we've had protests every Friday, very constructive type of protests. So with public forums, with the discussions, with intellectuals speaking out on what's not being done right. At the same time, when the whole restrictions related to either you have to be vaccinated or tested or have had COVID to be able to go to some institutions. After that was implemented, we had an additional set of different protesters that started happening on Wednesdays. So for a while, Slovenia was actually the % country that was worse off based on the number of new cases weekly. At the moment, we have 56% of people that are fully vaccinated twice, and the number of people people that's vaccinated at least once is only 3% more, so 59%. So still very low. So yeah, full hospitals, 33.8% of the people that get tested are positive. So really, really, really high numbers. And I wished that things were better on that end. Yeah.
I wonder why, Tjasa, the vaccination approach here with those numbers. I mean, that's good numbers, right? 50%. We have 90.4% in Australia. So I'm wondering the difference here in strategy. I mean, it's maybe not something we could get to the bottom of today, but I'm definitely curious about the different strategies that we use to encourage people to get vaccinated.
Yeah, I think like on a global level, we heard a lot about that in the last 2 years. You know, what worked, what didn't, what was the attitude of the government towards the public. And here, I think that seems to be one of the biggest critiques that we see. So the attitude that the government has towards the citizens it's very paternalistic. It's very disrespectful. This is actually not a too strong word. It's just disrespectful. So there's also, a lot of corruption cases that have been present and revealed in the media with the protective equipment, with just things that have happened in the history, because we've got a lot of old faces on the political stage at the moment. So when you combine all that and when the public trust is eroded, obviously you can expect people to follow the leaders that they don't respect. And if there's a lack of respect on both ends, the results can't be good. So that's just the general impression.
Tjasa, it makes me curious. I wonder if those protests are actually like contributing to the stats around the country too. Like, are they spreader events where, like, if people are gathered together, are they actually there spreading COVID potentially?
It's a good question. I wouldn't want to speculate about that, but in theory, those, the protests that started on Fridays, they tend to be quite safe. So when the gathering was prohibited, basically people were using bikes to just bike around the capital and protest in that sort of a manner. And when that was kind of prohibited also, they started to use cars. Now you can be vaccinated anyway. So on Wednesdays, you protest against the measures. And I'm sure that there's less people that are not vaccinated present on Wednesdays. It could be, I wouldn't want to speculate around that.
Yeah.
Really interesting. It was there was definitely a feeling during the lockdowns here of that sense of maybe distrust, or even in Australia, what are they doing with these lockdowns? It feels very strict, but the reality was that we weren't going to get out of lockdown until we've got vaccinated. That was the message, right? Mm-hmm. We're going to open up once you get vaccinated, and we're not opening up unless you do. And there was that feeling, we need to learn to live. This is what they were saying. We need to learn to live with COVID, because we weren't used to living with COVID. No one we knew had COVID, right? Because the elimination strategy was so effective. It's not until very recently I heard that someone that I know of has recently had COVID, and they're fine because they were vaccinated and whatever. But that was what it was like here. It was this elimination strategy. You didn't really know anyone who had it. You hadn't heard of that. But we weren't going to get out of it unless we had the vaccine. That's what the feeling was over here.
I wish I could say the same for where I am, because I feel like I've known so many people. I run into so many people that have had it or have had it multiple times. They've been vaccinated and boosted and still got it. And I think that for me in particular, kind of straddling the borders between Mexico and California and seeing the different countries manage it differently, like, to your point earlier, like, the National Guard in Mexico was roaming the streets. Like, I was scared to go outside when it was the first lockdown went into effect, because there were trucks with men in machine guns that were roaming the streets that literally were like, what are you doing? Go back home. And I was like, yep, don't want to be part of that. Message received, going home. And then, I could cross only for essential reasons, which for me was a dentist appointment. And to see on the other side that people weren't wearing masks, were just sort of like out at the park, kind of, it felt like wasn't being taken seriously in parts of San Diego and other parts of California, where like they were just angry and just felt like they weren't going to manage it. And so where we stand now, California now has an indoor mask mandate reinstated, and I don't know how many times this is, has happened over the course of the last 2 years, but like as many times as they thought that we could like open back up and go back to normal, COVID has come back and said, no, not yet. We're not ready for that. And it has not gone away here in Mexico, where and there's never been an issue around mask wearing or getting your temperature taken before you go into any retail store. There was never any controversy about, whether it was the right thing to do. And sitting here and also knowing that Mexico is a destination place where people travel and come on their vacations, that when it did start to open up in the U.S., that people unvaccinated mostly were coming to Mexico for their holidays because they could essentially get away with it, right? Like the U.S. was in lockdown, but Mexico not so much. And I honestly, it was really hard to watch because it just felt like, oh, okay, you're going to come, if you don't think it's a big deal, you can come and potentially spread it to communities for, folks that don't have as many resources and aren't in a position to not work. Like they have to put themselves out there because it's their way of living. And, and just spreading it more and more. It's it was really hard to watch and say oh yeah, good for you for going to Cancun or Cabo or Tulum for your vacation, and then potentially spreading this disease even farther.
Mm-hmm. Yeah, I want to just add two comments related to this topic, and then hopefully we can move either to a little bit more pleasant things such as digital health and what we've been doing on that front. But one of the things that I thought was quite interesting to observe from the sociological perspective during all this time was that in Europe, because you've got so many different healthcare systems and still diverse cultures, there was a lot of polarization, because obviously you can read today how other countries are managing the pandemic, and there was no unifying approach to how the pandemic is going to be handled. There was a lot of diversity in how Sweden did it, in how Austria did it, in how Slovenia did it. And then, if you already have a situation where the people don't trust their leaders and they can compare what other leaders are doing, not taking into account the culture of another country, that can cause additional dissatisfaction because some country is less restrictive than your country is. And, throughout the interviews that I've been doing this year, I thought that the case of Taiwan was really interesting, because Taiwan, again, was super successful in 2020. They were successful because it's an island, because they had experience with an epidemic situation in the past, so that they knew that they need to go into lockdown very fast. They're not a member of WHO, so they didn't have to comply with the recommendations that the WHO did. But what ended up happening in 2021 was that they had a huge spike in cases because the pandemic was handled really well and there weren't many cases. When the vaccines came out, nobody wanted to get vaccinated because there was no COVID and nobody felt the need that they should get vaccinated. And then when a wave actually happened and people obviously became interested in getting vaccinated, the vaccine supply was too small to vaccinate enough people. So, you ran into the whole wave of COVID. It's again under control now, but to me, it did show to how interesting it is that the human psychology is so very important when it comes to these topics, and how you talk to people and how you communicate and how can you convey a message so it's well received. But maybe Joy, going back to your road trip, tell us a little bit more about that. What was that all about?
Sure.
About that. What was that all about?
Well, so, I mean, if it started in 2020, I went with just me and my dog. And I was like, we went around to 8 different states and figured that was a safe way to travel. I literally brought my tent and camped, in different national parks or state parks, and actually visited friends, but camped on the side of their house instead of coming into their safe space inside. And I got super inspired by that. And thought, how can I make that something that is accessible for the community? It felt like a really empowering time for me, and felt like I was this is just something that helped me, 1, connect with nature, 2, connect with myself, and then also the family, friends, and colleagues that are really important to me. And I just thought, this is too awesome to not share. And so at the very beginning of 2021, I was able to secure a collaboration with Hymns. I shared the idea that I had, which was, hey, how cool would it be if we created a road trip to Hymns with setting the intention that COVID's not going to last forever. We're hopeful that a vaccine will be made available. And then by the summertime, we can maybe start to connect all of these communities again. And so they got really excited about it. It was officially became a thing. And so I started coordinating with all of the Hymns regional chapters across the country along this route. And we basically traveled through 32 states starting in May. So as soon as I got my second vaccination and waited 2 weeks for, the right time, I basically started in California, went all the way across the southern states, up the East Coast, and back across the northern states, and then finished the road trip at Hymns in the first week of August. And so through that, like I said, it was 32 states. We facilitated more than 20 hikes and invited women and community members in health IT, mostly connected through those Hymns regional chapters, to join us on outdoor hikes in beautiful parts of their region. And got to talk to some amazing people and kind of facilitate not the full reopening, but just a way for people to get out of their COVID bubbles. At that time, it was a really unique, special time. And then be there in person to share all of that with, at the first in-person conference again in August. And so
what were the discussions like?
People would talk about,
what did you guys talk about?
Yeah, everyone was sharing their experience through COVID. So I feel like I got this really unique opportunity to see how did people in Texas handle it? How about in Tennessee? Or what about out in the lakes of New York? And so, I got to kind of witness other people's bubbles. And so they were talking about just struggles they had. A lot of them had to do with childcare and the transition into managing everything, right? Of having to manage their kids and their work and the home life, and what were the struggles with all of that. People talked a lot about their mental health, what they were doing to just sort of stay sane. And whether it was, getting outdoors or knitting or learning how to make margaritas, it was interesting. And then also, just unique opportunities that they're doing with their work. How has their work life and digital health and technology been changing? And so, I feel really fortunate. It was that was a really special time, for sure bucket list item of my life.
That's amazing, Joy. It really is. I mean, even blows my mind to think about traveling, that distance. We've never been on a road trip before, ever. We always take the plane. So that's amazing. Had you done anything like that before? And obviously you're a very good driver to do that.
Well, so on the first round of the road trip, I was in a Prius, and it was just me and my dog. But when I came back, I traded it in for a four-wheel drive. I got a 4Runner, which maybe that doesn't mean much to anybody, but in Mexico, it's like the roads aren't as well paved. There's way more potholes, and it just made me feel safer. Yes. But in order to do this big trip, I actually thought like, well, we're going to have luggage. We're going to need more space. I actually learned how to haul a trailer. So I got a 20-foot trailer, and hitched it on to the back of my car and hauled that. And I would say that was the biggest challenge, because I had never done, like, it was all girls and my dog, right? Like, I had never done anything like that before. It was super intimidating. And parking that thing, turning it around, finding the right route that would, like, you know, accommodate us were parts of the challenges. And I have to say, I did have to call AAA a few times to help me out of a couple jams I got myself into.
So it was a year of practical skills.
Yeah, for sure.
And it was a book year for you, Bianca, right?
It was. I've been working on this book for 5 years, and then I just decided this year is the year I'm publishing the book.
Congratulations.
And I did it in the most, thank you. And I did it in an unconventional way, of course. You know, I don't follow the status quo usually. So I decided to publish it as a digital book, given its digital health. I thought I would do it that way, but make it that people could print it if they like, and then, you know, in the future I could make that option as well, you know, that it could be sent out. But with all the costs of actually sending a book to, say, America or Slovenia, I would have to charge, you know, I don't know how much to get that book to the person, and it just seemed incredibly complicated. So digital publishing was actually really good, and I had fantastic editors, Jack Merther and Tom Castles. You know, they do a lot of work in digital health. They're digital health journalists, and we worked together, and they helped me turn a 300-page book into a 77-page book. So we got to the point, we kept it nice and concise. It's all about the digital health revolution, making the digital health revolution, and all the revolutions that are going to, you know, be involved in this digital health revolution. So we talk about the technological revolution, which is the AI revolution, scientific revolution, personalized medicine, precision medicine, cultural, so the change in how we think and what we want as societies, and clinical revolution is the significant change in clinical practice that is going to take place. And it's essentially a law and philosophy book, all about the evolution of law and philosophy that will precede the digital health revolution. It was a lot of fun.
Can you be a little bit more specific about, you know, what is the legal perspective on digital health? Because, I mean, we had an interview this year. I interviewed you about what is digital health law, and I think that's especially very gives you something to think when it comes to topics such as data ownership, data privacy. What does it mean to own the data? When you take the legal perspective of that, you know, just the word is yours. Tell us more about that.
Well, in really simple terms, digital health law has 4 branches. And so a lot of the time we talk about one of the branches, which is substantive law or compliance, but there are these other branches that I've been spending a lot of time looking at, and things like statutory interpretation, so looking at the meaning of words within legislation. There's also an assessment of lawmaking processes, and then also the philosophical, ethical side of things, you know, looking also at the nature of law. What is the function of law in society? How is it meant to govern us? What's working well, what isn't working well? So that's really digital health law, and this book is going into in many ways the philosophical aspects, right? The nature of law and lawmaking. So 2 of the 4 branches that are there. In terms of ownership, you know, you've brought up the discussion of data ownership, right? And this is probably one of the very contested questions in digital health, and broadly as we're, you know, living in the Internet of Things. And this is not a question that's going to be resolved anytime soon. But when I think about the question of data ownership, and I think about it from a legal perspective, a couple of observations. One is there's going to be a long and complex road ahead on this discussion, because we need to consider the opportunities and costs in any given approach, and certainly lawmakers will have to. And just like, the scales that we use to represent law, right, representing the field of law is a balancing of various diverse perspectives and oftentimes completely opposing views of how we should function as humans and as society have to be somehow balanced by law. And sometimes we find that the answer actually exists in the middle of those polar perspectives. So in this context, you've got on the one hand people who say that patients should own their data, or consumers, and those who state that the doctor and the third parties should own the data, right? When I ask other lawyers about this topic, they ask me a question back, which is, why does there need to be an owner? Why does there need to be an owner? And my answer to that is, well, the concept of there being no owner for data is actually foreign to common law. And they return, well, we're legislating. The predominant form of law today is legislation, not case law. And so legislation does not actually reflect what the common law or case law precedent reflects. And they argue that legislation reflects something called a bundle of rights conception of data ownership, meaning that we're looking at the rights that each party has in the data rather than focusing our efforts on who owns it, right? Who actually owns the data. But the bottom line is that either way, whether we agree on the topic or not of ownership and its meaning, we can't get around the need to determine if we should be allowed to sell our data, so if we can make money from it, and whether this is similar to commodification of the human, which is not supported in many countries. Like in Australia, we can't sell our eggs, right? And surrogacy and selling of eggs, it's altruistic. You can't sell your eggs here in Australia. That is illegal. And surrogacy is altruistic, so you cannot make money. You're only paid for reasonable expenses, such as travel costs. So in some areas, the law tells us that we can't sell ourselves. Now, another question is whether selling data is like, our data is like selling ourselves. Now, that's a whole nother, discussion. So in some respects, the law says you can't do this, but then whether that's reflected across the law is subject to varying opinions and arguments, because you could say that in other respects it does permit a form of commodification of the human. And that's where it gets really interesting and challenging. A few years ago, I wrote for LexisNexis, which is a publishing house for lawyers, and I wrote an article about this topic. And what I attempted to do, it was for a legal audience. What I attempted to do was to define the meaning of ownership according to various constructions. So that is plausible meanings for the word ownership. And I tried to run an argument for each definition based on case law and legislation and commentary. So I'd personally love to see more articles like that, and people coming in and saying, Bianca, you're wrong because of A, B, C, or this is how we should think of it, and just more articles like that. I'd also like to see articles talking more about practically how it will work. Eric Topol published one a few years ago about the practical side of things, how it would work with data ownership, what his perspective was, and I thought that was really good. I really enjoyed that. Also, we need some pieces out there written about the times it's gone wrong, the times where a patient has sued a doctor to find out specific methodologies and processes that they used to diagnose them with a condition. There's one case that I'm thinking of right now where a person who was diagnosed with narcissistic personality disorder wanted to understand the exact steps that the psychiatrist took to diagnose them with narcissistic personality disorder. And they were so determined, the matter actually went to court to see whether they could gain access not only to their health information, but also to the method. So that's one side of things. But we also want to see discussion of cases in the times where patients were very unjustly refused access, even though they had a reasonable basis for it. And they were acting reasonably, right?
You mentioned one very important word 2 times, and that's access. And I think that often gets maybe confused in the discourse, because what patients want is access to their data, that they can share their data, and that doesn't necessarily mean that they want to be the sole owner of the data. I think, from the patient perspective, it's scary to think that, now I own the data, which means I have to take care of the data. I can't lose the data. It has to be safe. And in the digital form, that means that I have to be aware of all the cybersecurity risks that I might run into. Access is also something that is changing a lot in recent years. And I mean, if I just look at some of the examples that have happened and reflecting on what I found out or saw in the last 2 years, it was the open notes in the US, where now you have to have access to the data. So doctors need to have you access to your notes. It was quite shocking for me to learn that in Denmark, patients have had access to doctor's notes since 1987. So, 1987, 34 years. Yeah. So I think that's pretty amazing. And at the same time, if I count into that all the interoperability challenges, I do think that, the way forward is going to be for patients to be able to accumulate their own data and do whatever they want to do with that, share it with whomever they would like, so that data gets analyzed. So I think, Joy, you also wanted to say something.
Yeah, there's a couple things that are coming up for me. And one is, like, in the U.S., we've got this new access law where providers are required by law to give patients access to their records, which is amazing. But I know that some healthcare providers are also challenged with our HIPAA laws. And so, like, the overlap between, like, HIPAA privacy rules and the need to provide access is kind of murky for especially people who don't study regulation or study law. It can be, like, kind of confusing on how to implement these things. But I think that the intent behind them are really great, and I'm glad to see it. But the thing that I was thinking about was, and I don't know how much you guys have access to this and where you're from, but, like, in San Diego in particular, there's several, like, data libraries. And so they're not necessarily tied to an individual organization or a government entity or whatever. There's, like, independently owned housing facility, essentially, of, like, clean, accurate data, so that when people want to ask questions of it or do particular projects with it, they literally, like, check it out. And it's not unique just to healthcare. It can be, information about pets or libraries or, all kinds of stuff. And I kind of like that idea, and I don't know how willing private industry would be to participate in such a concept. But the idea that, like, once you have these data sets, that, they become available for people to make use of them for all kinds of different purposes. And I feel like that might be, like, legally, I don't know what would be involved. I know folks would be a little bit hesitant to share data that was very, hard to get probably in the first place. But I do like the concept of, like, hey, once we have it, how can we put it to the most use?
Answer. So I can provide, like, two potential answers related to healthcare in this regard. So basically what you're referring to is secondary use of data, which is especially huge, I would say, that in the pharma industry. So you want to use data for something else than it was initially produced for, so using patient data for research. And in Taiwan, for example, they also have been digital for a very long time, had electronic health records, and there you actually have research centers like that. But as far as I'm aware, and it was explained to me, when you go into the research center, you can't bring anything with you. So you literally need to know what you're interested in. When you mine the data, you have to remember everything that you mined and what kind of findings you got. But it is there. So there is this healthcare data library that you can use for research. And at the same time, in Europe, Finland is a good example where the sharing and the use of data is well designed. So you've got an organization called FinData that you can apply to for research purposes, and then you either get granted or denied access, so you can do further research. But on a global, on a more broader level, there's still a lot of open questions on how can we scale these kinds of approaches.
Very interesting. And here in Australia, we have secondary use of data frameworks and a whole range of legislation that deals with data and how it can be used for public health purposes. So it's really interesting. I like this, discussion of digital health across jurisdictions and comparing and contrasting the various approaches. And that's something that I think, Tjasa, you've really championed with your podcast, which is talking about the various approaches by different jurisdictions, which is fantastic.
I know, Tjasa, can you tell us about your past couple of years? I feel like we haven't had a chance to hear your side of the story.
Yeah, so pandemic-wise, when just 1 week before the pandemic started, I went back to work because I was on a maternity leave for a year. That's what you get here. So you basically get a year off. And parents so the mother and father can divide that time between each other, but like you have the time to be at home. Daycare starts after the first year of the child's year. And I really like comparisons of that access, across the world. Again, like in Austria, you get between 1 and 2 years. In Sweden, both parents get, I think, 16 or 18 months off. So I always, am very interested to see those examples because I know how little time mothers in the US get in that regard. So going back, a week in, the pandemic started, so it was really tough for me to just really start working. But just podcast and digital health-wise, one project that was a little bit larger for me in 2021 was the documentary about medication safety. This is a topic that I've been interested for several years. I did a master's degree in how different hospitals on different levels, so primary, secondary, tertiary care, how they take care of medications. And in the healthcare IT company that I work for, I'm in the medication management team. So we provide the electronic prescribing and medication management system for hospitals, and I'm now learning about all the challenges from the side of pharmacists, from the side of doctors as well, because I, as a chronic patient, mostly see these things from the patient perspective. So in the documentary, which is called Overdose, I was exploring what are the causes that medication management is still very difficult today. And it's difficult because of the processes. It's difficult because any technology that you try to implement is first and foremost a cultural change. So you need a lot of preparations for the implementations. You need to train people. You need to get the buy-in so people in the end use the software. There's challenges such as lookalike names, drugs that have very similar packaging, and all that can really cause problems and errors in the medication management space. And there's a lot of deaths related to medication administration errors, prescription errors. And I would just encourage everyone to really look at the documentary that was recorded with 15 experts from 10 countries. I again took, a very international approach because I was again interested in to see to which extent do the views on medication management differs, and it turns out that it's very similar in many cases. A huge challenge is interoperability, so the fact that when a patient enters an ER or gets to the hospital, it's very hard for the clinical staff there to know what exactly does the patient take, because there's no connection with the GP. The UK is making great strides in this regard, but in essence, in the US and Canada, with the opioid crisis, one of the reasons was that it was impossible for doctors to know if a patient that came in for pain management, if he or she was already in a different ER to get another prescription. So just understanding how the patient medication history can impact what you're going to prescribe and what kind of mistakes can happen is huge. Not to mention the challenges that EHRs and electronic systems bring with alerting, with the burden for the doctors. It's a hugely complex topic.
It is very complex, very interesting. Also interested in the patient responsibility there as well. Tjasa, what are the key things that need to be resolved to reduce patient harm due to medications? I mean, you mentioned interoperability. Is there anything else that comes to mind?
I guess one of the things that I think is quite interesting, or was at least like a little bit of an epiphany to me, was when Abdullah Al-Hawsawi, who's from Saudi Arabia, he's a huge expert in patient safety and reducing patient harm, and he said that kind of the missing piece in the whole medication management story is really the patient. So knowing the complexity the clinical environment presents, knowing that when you get into the hospital, you're not really necessarily getting into a safe space. You've got nurses there that are overburdened. You've got doctors there that are busy, especially now in the COVID time. So mistakes can happen really, really quickly. So it's really important that you or your family is really mindful of what's happening. Is the nurse giving you the right drug? Is everything happening the way it was set? It is, and it's for the patient. When you're in a vulnerable position, it can be a little bit hard to comprehend everything that's happening, which is why it's so good that if you have the chance that you've got some support, a family or a friend there that can also kind of be in the process very mindfully, not because we would distrust the clinical staff. That's absolutely not the case, but just being knowing that the complexity of the clinical environment is what can cause challenges. In the US, many healthcare institutions already use closed-loop medication management systems, which means that the medications are also checked with barcoding. So the patient has a barcode, the drug has a barcode, and you scan both before giving it to the patient. But many other institutions don't have that. So you really need to be a very present and mindful for patients, and that I think it's something that we still need to kind of adopt. But that also requires a cultural shift, with where more collaboration among the clinical staff and the patient is normal. I think it's still very hard to speak up, as a patient, because your life is in danger. You're scared, and you're not your normal self. And it's easy to say that we need collaboration, but when you look at what exactly does that mean, it becomes much more complicated. Similarly, as when we talked about, what does it mean to own your data and who should own it?
Yes, it's very hard to speak up as a patient, and I think people need to be mindful of that, and education, awareness of this, and is really important. And we mentioned family support. I mean, some of us have family support, others don't, so that's a challenge as well, especially if someone's sick, maybe not thinking clearly, and they're now in the hospital environment, perhaps by themselves. So there's a lot of work there that we can be doing to empower patience, you know. I think we've all been there. We've all been in that situation.
And speaking of empowerment, Joy, you know, one of your basically focus of the Hit Like a Girl podcast is all about women empowerment, femtech. Can you tell us a little bit about what kind of findings did you came across in 2021? How would you condense that?
Oh my gosh. So I have learned a lot. I've met some really amazing women and just kind of learned a lot about just what we're facing as a group of people, mostly in the US, but, you know, some out international. But some of the stats have been just kind of profound. Like, one thing I've learned is that women, especially like millennial age and younger, are getting more education and are like outperforming their male counterparts. And so turns out that within the next decade, 70% of our workforce is meant to be women. And so when I think about like, okay, how do we treat the women in the workforce now, and how is that going to have to systematically kind of change and evolve over time to address, so that like people within C-suites or leadership positions, it's actually reflecting, you know, the community of people that's actually in the workforce. And we have a lot of work to do. That's essentially what I've like. There's a lot of work being done, but there is a lot of work still yet to do. And so some of the things that I've been really inspired by is some of the technology and research that has been pointed at women specifically. So for women's health, I've seen a lot of focus on like including one, targeted therapeutics, making sure that there's more available for different types of cancer. Like that has been really, encouraging. More research and products available and studies on endometriosis, something that affects, mostly women. Like it's 99 of the folks that have endometriosis are women. A more focus on menopause and supporting women through IVF treatment and just throughout their whole stage of their lifetime. It's been interesting to kind of think about how a lot of the technology apps or resources available for women have this lens that has to do with reproduction. But we are much more than just being moms. Like being moms is a big part of being a woman, but it's not the only part. And so one thing I've been really inspired by is to see technologies for women as they age. Like how can they be empowered as they're on the road going through menopause? And also some of the other encouraging stuff is that like, even though the baseline has been relatively low for investment in women-founded organizations, but the stats are improving, that there has been a shift in the needle, that there is more investment funds going to women-led organizations, which is good, but it's good to see progress and also know that we still have a long way to go.
Mm. We haven't talked a lot about, the position of women, but I think in the pandemic that has also become one of the bigger topics with women, especially in the US, more often leaving the workforce because they had to take care of the children. And I must say that, looking at the global picture, it's quite worrisome to see how on the one hand, there's this whole movement about women quotas, about women engagement, about supporting entrepreneurship of women, and in the same society, you've got Texas that accepted the new abortion law where, after 6 weeks you can't have an abortion. You've got a similar case in Poland where women basically can't get an abortion unless it was an incest or a rape case. So it's, from that perspective, I see that we still have a lot of work to do in the society when it comes to what does it mean to have rights as a woman in the society.
Well, and the other thing is looking at maternal and infant mortality rates in the U.S. Like I learned that an American woman is 15% more likely to die during childbirth now than her mother was in just one generation before. And so it's not really, we have not made it a particularly safe place for women to have kids in the United States, specifically for brown and black people and underrepresented communities. And so it's a harsh reality when you think about it, when there's certain states that have access to care and others that don't even have access to education. It's not like there's a prohibition on even talking about certain things. And so that's a little bit of a tough pill to swallow. And speaking of pills, I believe that it was this last week that the abortion pill by mail just got approved, so that women around the country, if they live in states that approve of them getting it, are able to get an abortion pill through mail, but not if they're in particular states. So I don't know what this year is going to bring. I mean, we're close to potentially overturning Roe. And I feel like without having the balance of okay, well, we're going to provide child care or other types of resources for families, we're really kind of setting people up for failure, which is pretty unfortunate.
A huge topic, I guess, for equality, and I'm sure Bianca, you in 2021 was a year for your book, but I guess a lot of people got to know you in 2020, including me, because you organized an event, Voice for Equality. So, can you tell me a little bit about, what does equality mean to you, and how do you observe the topic?
It's a really complex topic. I guess I don't see it as meaning anything in particular, other than finding that balance in a way that's reasonable and ethical and moral, and it supports people. But also we need to respect varying opinions as well about and values. So it's about respecting those values, but at the same time keeping people safe. And I think that's really important. So we need to keep people safe and healthy, and that's a value that I personally hold. Equality, it has a particular meaning in law, and it's used in law all the time. And it has, a lot of people like to talk about equity instead of equality, right? Rather than talking about us as being equal, because a lot of people say, well, we're not equal. We come from different places, and to say that we're equal is actually disregarding who we are and our circumstances. When I say equality and we're equal, I mean it in the terms of, as human beings, we're all human beings. And so that's where I begin, and so as human beings, I believe in certain things and certain protections that we should have. And so that's how I talk about the meaning of equality. But a lot of talking about equity. So how can we ensure that we're providing access to internet, to healthcare, to all these different things for people who otherwise wouldn't have access. And it's such an important topic. It always will be. It always, I think it always should be front and center, and especially as we move towards 21st century digital health. We do need to be thinking about this. So I did run 3 events, Voice for Equality, and one was with Amazon, and it was great. It was really great. And Tjasa, thank you for being part of that as well as the book, because you were a writer in the book.
Yeah, true, but it's we're slowly gonna finish off this discussion, but I think that when we talk about digital health innovation, at least for me, I like the optimism. I like the innovation that's happening, the disruption, looking at the U.S. Healthcare market, which has more problems than one could describe in a week, but at the same time there's so much new ideas coming up. You can see the disruption with now a lot of digital health companies are not trying to sell into providers but are becoming providers, which on the long run to me means that a lot of things might change, because that gives you a lot of a different power than if you just provide an app to an already existing power player on the market. But I always think, when it comes to these innovations, who is going to be able to access it? And I always wonder if, with the increase of digital technologies, are we just increasing the gap between the well-off, wealthy and healthy, and those that can't access or afford those technologies. And maybe that also goes to the fact that when you've got digital health startups, when they scale and when they decide to which market they're going to go to, they look at that from the business perspective. And I'm from the country with 2 million people, and I see all these amazing things, and I'm like, of course nobody's gonna come to a country with so many, it's just like 2 million people. So okay, yeah, I'm gonna move to the US for a while to be able to get a VR headset and some mental health well-being app, because I'm super curious about how that actually looks like. But I don't know, should we wrap up slowly? What do you guys want to say as some of the last words?
I'll go. I think that the thing that comes to mind is pulled from a conversation from one of the most recent podcast episodes. I got an opportunity to interview a woman from HHS. She was a part of regional health and human services for the U.S. government. She brought up a term around digital empathy, that as we go and move towards more digital health, we need to your point, have more empathy about who has access to that and how can we incorporate that into our business model. Because if we don't have empathy or digital empathy, we're essentially going to be creating more of a divide, and I don't think that's what any of us want. So
that's excellent. And something I'm talking about at the moment is multidisciplinary digital health strategies. Right, so being able to take the perspectives from various disciplines, medicine, science, psychology, business, law, commerce, and being able to put that into a cohesive strategy where you can, move forward as a business and hopefully succeed, but, take those various perspectives on board. So I'm going to be running some classes on that in 2022 online. And it's really important, because we have to, to some degree, we have to work together. We can't have these silos, and we need to bring it all together somehow, which can be very challenging. So I'm going to provide a guide in how to do that. It's been a really fantastic discussion this morning. For me, it's morning.
Midday for me. Yeah. I'm so grateful to be connected to both of you. This has been great.
It's amazing. And to think we're on the other sides of the world and we're here together online. This is what we need, more of this, more of these kinds of discussions, which you're both creating that on your channels. And it's just
as are
really
you.
Great. Yes, I'm trying as well. So we're in 52 countries, the Voice of Law podcast, and growing, and it's just great to be able to speak globally, and let's continue the discussion from here. We could chat all day, I think. About it.
I think you're right. There's a lot we haven't touched on.
And we'll debate that, I guess, in a separate discussions, and think of new ways that we could again work together and exchange experiences. Maybe end of 2022.
Yeah. Tjasa, imagine all of us, if we could get a sponsor and do a data ownership debate. I think that would be amazing. Let's get some scholars from Harvard, Oxford, and then some of the other unis that are lesser known, and from all around the world, and debate data ownership the way it should be done. I think that's something I'd love to do.
An idea to discuss. Okay, so thanks guys, and thanks everyone that joined the discussion today, and let's continue the discussion. We can all connect on LinkedIn, and hopefully some new projects and new ideas can come out of this. Thanks.
Thanks, ladies.
Thank you.